Hi students, it's Dr. Ways and welcome to your lecture on the shoulder and pectoral regions. So a general overview of this, and you're going to see this is true for all, we're going to do the upper limb a little bit differently than we did the lower limb. We'll show what the muscles are and we will talk about them in relation to kind of what they do. But we're not going to go over all the details of them until the end where we have a specific lecture on muscles of the upper limb. So keep in mind that everything that we're doing in this lecture, even though it's the shoulder and the pectoral region, is still controlling the movement of the arm itself. So we'll talk about the muscles and the various nerves and blood vessels that are associated with these regions, although in our overview of the upper limb we already did cover a lot of this stuff, so some of it you'll see it being a repeat. So the pectoral region would include everything here between the clavicle, sternum, and the arm itself right here. All right, and then there will be the Pectoralis Major muscle here. There will be a Pectoralis Minor underneath it, and then we'll see the Serratus anterior deep to that. And then the shoulder muscles, a lot of the shoulder muscles are actually on the back, so that's why you'll see in the next couple slides the shoulder and back. So we're not specifically talking about back muscles, we're talking about muscles on the back that are related to movement of the shoulder and the upper limb. So those muscles will include the trapezius, although it is not shown here, the Latissimus Dorsi, the deltoid, and then there are going to be some deep muscles that are associated directly with the scapula itself. All right, so this is a posterior view of the superficial muscles of the shoulder and the back. The biggest one is right here, the Latissimus Dorsi, and you notice it's kind of a triangular shaped muscle that starts at the spine and goes all the way to the shoulder. And of course, major function, when you contract, it's going to pull the shoulder in this direction. And then you have the deltoid here, which is part of the shoulder but attaches to the arm, which will be involved in abducting your arm away from the midline. All right, and then the third muscle that's not shown in the picture on the right but is shown here in the picture on the left is your Latissimus dorsi. And even though it's a wide, broad back muscle on the back rather, notice that its attachment is to the arm, so it is going to play a big role in the movement of the arm as well. So one more space in this, that actually a couple more things I wanted to show you. One is this triangle of auscultation right here. That has the border being the trapezius, the Latissimus dorsi, and the medial border of the scapula. So that's what you see here laterally is the medial border of the scapula. And the importance of that region is when you are wanting to listen to breath sounds on a patient's back, you will generally have them put their arms out in front of them in like a cross position, so cross their arms in front. That will widen that that triangle of auscultation, and you're going to get the best breath sounds you can possibly get in that particular region. All right, so one thing you might want to practice is, finding where that triangle of auscultation is by knowing where the borders are and where to look. Have your lab partner cross their arms in front and listen to breath sounds in that region, and then move your stethoscope over a little bit, maybe over here, and listen to breath sounds in that region and compare how much clearer it is in that triangle of auscultation than it is in another area of the back. All right, back in the thoracic cavity, we talked about, or in the respiratory section, when we were talking about listening for breath sounds, we definitely said avoid bony regions, so avoid the scapula, avoid the spine, and try to go for intercostal spaces. But now we're adding this new dimension, this triangle of auscultation, where you can actually get some of your muscles out of the way too. So something to keep in mind for clinical practice. All right, another thing I wanted to point out here is here's your scapula, here is the medial border, there would be the lateral border, and here would be the spine. And you notice that the spine has two sides of muscle attachment. One is for the line of attachment for the deltoid on the lateral side, and on the medial side you have the line of attachment for the trapezius. All right, and you notice that that goes all the way around the spine of the scapula to the acromion and even onto the clavicle. So this muscle, these two muscles, the deltoid and the trapezius, completely wrap around from the posterior side all the way to the anterior side, kind of showing the breadth of muscle control over the upper limb that these two muscles have. All right, if we take the deltoid away and we take the trapezius away, what we're left is looking at the scapula. And we have two pictures here. We're going to focus on this picture first. If this is the spine of your scapula, and above it is the suprascapular fossa, then your supraspinatus muscle is going to fit inside of it. So, you know, the muscle is named according to where it's actually located. And so the infraspinatus should make sense to you as well. Just inferior to the infraspinatus, you'll have the teres minor. And just inferior to that, you'll have the teres major. And you notice the only difference between them is really their point of attachment. Teres minor on the posterior side, we'll talk about what consequences that has. And the point of attachment of the teres major on the anterior side, we'll talk about when we get to the muscle section, the consequences of that as well. But minor in this case refers to a smaller muscle, and major refers to the bigger muscle. And you notice that the tricep brachii bisects the teres major and the teres minor. So three spaces you should be familiar with in the shoulder in reference to the scapula and the muscles that are on it are the triangular space. And you can also see that triangular space up here. The borders or the boundaries of it are the teres major, of course, down here, teres minor up here, and then the triceps brachii here. And you notice that there's an artery that goes through that triangular space. And that artery is a circumflex scapular artery. The next space is the quadrangular space. So easy to look for because you expect to look for something that is a quadrangle or has four sides to it. So right here is the quadrangular space. Not to scale, obviously, because I'm using a crappy stylus. But you can also see the quadrangular space up here. And what is going through that is your axillary nerve and your posterior circumflex humeral artery, with the boundaries being the teres major, teres minor, the triceps brachii, long head, and the surgical neck of the humerus, which you can actually see better up in this picture to the right. All right, and then the final spot you need to know is the triangular interval. All right, and the triangular interval is down here. We'll draw it. And the borders or boundaries are the long head of the triceps brachii, the lateral head of the triceps brachii, and the teres major. And nothing is going through there per se, but what you can see from the posterior view, you can also see the triangle or the triangular interval here, is the deep brachii artery or the profunda brachii artery. Profunda will mean deep. We'll see that as we move along throughout the upper limb lectures, as well as the radial nerve. Remember back when we were looking at the axillary artery and we talked about that there are three parts, and we talked about the branches that were coming off each one of those three parts. But for this slide, we're just going to go over a few of those branches. The one branch, the suprascapular artery, supplying the muscles that are above the spine of the scapula. And here's the axillary artery for reference. The anterior circumflex humeral artery. All right, notice that that's wrapping around the anterior portion of the humerus, around the surgical neck. The posterior circumflex humeral artery, which is wrapping around the posterior portion of the surgical neck of the humerus. And then the circumflex scapular artery, which is coming from anterior and wrapping around the backside. And these all together are forming anastomoses. And remember, we talked about these anastomoses in the shoulder region, just like in other joint regions, that if one side, anterior or posterior, gets occluded, there is going to be an alternative blood supply from the other side to ensure that the muscles, bones, and other structures in that area get the blood supply that they need. All right, as far as the nerves go, we have the suprascapular nerve, and remember back to the brachial plexus slide, lecture, we talked about what that innervates, the axillary nerve and what that innervates, and then you see the radial nerve coming down. And what I want to point out about the radial nerve, this is a nice picture, is it's going down the lateral side of the humerus, and then will eventually, after it gets to the elbow, meet with the radius, hence why it's called the radial nerve. All right, for the pectoral region, the most obvious muscle, and probably a muscle that most people would know, whether they're medically oriented or not, would be the pectoralis major, also known as your pecs muscle. Coming here from the clavicle all the way through the entire length of the sternum, down along the costal cartilage, and then ending up back here attaching into the anterior side of the humerus. All right, so that tells you that it's going to be involved in moving the humerus. And again, we'll talk about that later on when we get to the muscles. That is a very large muscle. Remember, if a breast tissue will sit on top of that muscle. All right, so something to keep in mind as we go on to the next slide. Because underneath that pectoralis major, and you see it cut away right here, and cut away right here, before you even get to the muscles that are deep to the pectoralis major, you have this clavipectoral fascia. All right, so clavipectoral, covering this entire region, fascia. So it is a connective tissue that is between the pectoralis major and all of the structures that are underneath it, or deep to it, if you will. And it completely surrounds the pectoralis minor muscle, which is right here. So this would be the pectoralis minor muscle right here, going from the coracoid process to ribs 2, 3, 4, and 5. It also surrounds this little subclavius muscle up here, so miss it if you didn't get pointed out. So subclavius muscle, and just like we saw in the lower limb with the fascia lata, there is an opening here for a superficial vein. So the cephalic vein will go through this opening in the clavipectoral fascia and then continue down the arm superficially. Actually, it would continue up the arm into this opening rather than the other way. All right, major arteries, pectoral branch of the thoracoacromial artery is coming out here, that same opening in the fascia. As far as nerves go, you have the lateral pectoral nerve coming out of that same area, and then the medial pectoral nerves piercing through the pectoralis minor and the fascia to reach the pectoralis major. And then finally, we have the serratus anterior muscle. All right, these are all pointing to the same thing. It's this serrated appearance of a muscle that's running along each one of the ribs here. And then its other attachment site is going to be the medial portion of the scapula. So as you can imagine, it's going to pull the scapula this way. And its nerve supply, or the nerve supply that's running along it as well, is going to be the long thoracic nerve. And we saw that when we looked at the brachial plexus as that big long nerve coming from C5, C6, and C7.